So what was that crucible like for you as you described it?
Yeah, that's it. So a couple, I think there's a couple context pieces that are important. So in 2017, I ended up promoting into a job which is largely like 90% administrative. Best equivalent would be like I don't know. I run a couple hospitals in a couple counties, and so I don't know whether it'd be like I don't know, like it'd be a oh 06 or oh 07 or level job, something like that in the military, and so largely command, big budget, 3,500 people in my chain. Um, all of that stuff, right? And I was still a physician, so as in our organization, you're still a physician at least a little part of the time. So even for a job like mine, where it's mostly administrative, and it's not unlike the Air Force, like where people who are generals who are pilots get to go fly the airplanes every once in a while. They let them behind. They don't let them go do the actual wartime fighting, but they let them go fly around. And so I'm kind of that version of the doctor. I feel like I always tell people like I feel like they're always going to look over my shoulder, but mostly command. Um, and I did it again. I was one of those reluctant leaders, but I had this sort of idea that like at the lower level, being what I was a clinic chief, if I could help create culture and move change and all that stuff, well, boy, at this high level, how cool would that be? And how can we impact communities and all these things? Um, and I never could have foreseen 2020, January 2020. I got a phone call at night that airplanes were coming in to Travis Air Force Base. Um, I don't think well, it's not secure anymore. I don't think at least, but from Wuhan, China, with State Department workers, some of whom were infected with this virus. Um, and at that time we didn't know anything about it other than China didn't look good at the time. Like other than like they were like, wealthy people's doors shut on their homes there and you
I
know,
mean, it was
and so
scary. Like everyone no one knew what I felt like in January, I felt like I was just sitting on my porch waiting for this like tidal wave to come through and just like blow away everything. And you couldn't see it. You didn't know when it was coming, but it was coming. And
yeah.
like it was suspenseful.
Yeah, so those were the very, very first COVID patients in the US coming in, that were actually being actively brought in. Now, there were probably some that had come through airports and stuff like that we didn't know about, but these were the very first. And it was the Travis, and there were some other West Coast bases where they were coming in. And so I was called as the leader of one of the hospital systems to say, okay, they're going to be housed at the base, but they're not getting their medical care through the DoD, any of that stuff because the DoD has to have operational readiness, right? Like that's not the DoD's main mission. And these were, civilians, right? Um, and my life really changed at that point. It was super interesting because we had to think about, okay, what does it look like to take these folks, how do we transport them from the base to our hospitals? How do we, and we have protocols, right? We had protocols for Ebola and stuff like that never really came. But what does that all really look like? Um, and it was the first time I had to ask people, my team, my physicians and my teams, to actually put themselves in harm's way, um, in a very real way, because people just didn't know, like they didn't know the risk, right? There was all this fear. Um, And, it was everything from that to calls with the CDC at the time and because the CDC was here and they're with no sort of developed plan yet around COVID because it was brand new. And trying to think through like, okay, what does this mean? How do we do this? And then when the first community case came up, okay, how do we protect our people? What does that mean? Like we didn't know anything. And this is entering sort of January, February, March when, there were national public health leaders saying, no, don't wear masks. Masks are not indicated. Don't do that. And, trying to mitigate all of that while we, looked at potentially running out of supplies, gowns, masks, all of it, like running out. as the numbers started to pick up. And I would every night I would literally go to sleep pretty much thinking at some point I'm going to be going to the funerals of my physicians and my nurses who are taking care of these patients because there's going to be, there's going to be broad infection, right? Like my colleagues are going to die. And I'd never in the military, like I'd never been in a command structure, operational command structure where I was having to make decisions around how do we keep people safe? And then how do we take care of these patients at the same time? Like, how do we do both those things with limited supplies, limited information, all that stuff? And yeah, it was all encompassing. It's like everything we thought about all the time. And it was, I mean, I barely slept, maybe 4 hours a night. Um, and again, deployments are, the military is really smart, right? When you go to a hot zone, right, you go for a certain amount of time and they pull you out. Even like SEAL teams and stuff like that, right? Or your frontline infantry folks, you don't spend much more than typically 3 or 4 months doing active combat, and then they pull you out, they pull you back into, you got to go to LUD, get some R&R.
You can't spend that much time switched on like that.
Yeah,
It's
but
too much.
we didn't have that option, because the world went sideways, right? Everything got shut down. We didn't get shut down. Um, And as you know, sort of there were these sort of like false waves of COVID that came. And yeah, and then that same year, the incident with George Floyd happened. And that threw, my medical center and our people into, all that disarray spilled, both internally with our people. Um, and then COVID got worse. Um, and uh And I just kept pushing, and by the end of 2020, and again, I was of the belief that I had enough energy, enough brains, enough everything, like, I didn't need to sleep. I could just stay up, I could do it, I could push, I could be present enough. I was gowning up, and the first doctor that became symptomatic that we thought might have it was like 6 o'clock at night, and we didn't have a protocol for, like, how do we test our people yet? And so I gowned up, put all the stuff on, it was the old days when like we were like doing all this handoff stuff, very, very careful. And went in the room with this poor, scared to death doctor and swabbed him and stuff that's very routine now, but at the time, you know, it was not. And I'm not saying that to actually make myself look heroic. I think it sort of points out the pathology I had of thinking I could be Superman.
And
Um,
also that, like, you weren't willing to sacrifice anyone else for this thing.
yeah,
Like, yeah.
yeah. I mean, it was very much sort of like the classic, heroic military story of like, the guy that runs into, your Medal of Honor winners they're just, the highest example of, human beings ever. But this sort of idea that, in military culture, it's what we do, right? That's what we do. And I think what I didn't realize at the time was one, the box is full of stuff already. And by the end of 2020, and I'd experienced some mental health blips before, like where I had some dissociation from my emotions and stuff like that, where I just become dead, you know,
Mhm.
you know, dead above here. Um, but by the end of 2020, um, I was not okay. I was not sleepy. I was eating, I was pretty much on a steady diet of like ice cream at home at night. Um, I was more short. I was a lot more command and control. And then I was less empathetic with my troops, with my teams. I'm calling them troops, but like my teams who were getting sort of more and more burnt out and more angry. Because they were starting to treat each other bad and treat people in my command structure badly. And I saw around me my teams just killing themselves trying to support the people doing the work. And I essentially had this sort of breaking point moment. I remember really distinctly. I was meeting with a large group of physicians, and this was online. This we had already gone to Teams and stuff for a lot of our meetings, Zoom, whatever. And I kind of lost it. Was like because they were really rough on me, and it was a group that I'd spent the entire year trying to protect, equip, arm, all that stuff. And I kind of just lost my professional demeanor. And first I got really angry, and I didn't curse or anything like that, but I was just really like, shut up and stop whining kind of thing. And then I got emotional and got teary, and I was like, whoa. And there's nothing wrong with that necessarily. I think vulnerability in appropriate circumstances is fine. Um, but I had realized I'd sort of cracked in half. And so the next day I ended up calling our EAP is what we call it in the civilian sector. Essentially, it's the company psychologist that we have on staff. Law enforcement has it, we have it, and said, "Hey, I gotta see you and get some help." Uh, and so went in and kind of started a journey around. First time I'd really seen it there. I'd actually seen her 1 year before. I'd witnessed a 17-year-old girl got killed on the freeway. I was the first responder there for about 15 minutes with her and her boyfriend uh, because it was in the middle of the county, unincorporated, and was taking care of them. And she looked like my daughter. So I'd seen that woman a year before because I was having flashbacks around that. She saw me one time. I'm like, okay, good. I'm good. Back in the box. I'm fine. But I went back and saw her, and she specialized in trauma therapy. So there's something called EMDR, which is a therapy that was developed actually with veterans for PTSD. And she started taking me through some of that work. And what I found was, um, well, COVID had cracked me open. The box was quite full with stuff that I had just not really dealt with before. And it began for me with what was it ended up being a kind of a stuttering, multi-year journey on getting help around, why I was built the way I was built in regard to, the things that drove me into the career fields and the things I did, um, how I grew up, all of that stuff. Um, and in doing this trauma-based therapy, which was super helpful because it's not lay on the couch and cry and talk about your feelings, which I wanted no part of. I think like a lot of veterans, I'm like, that's what you're talking about. You go the other way.
Yeah, I mean, we're lean forward people, and
Yeah.
we require action, and action, a path, orders, action. Like, those are the things that we thrive
Yeah.
in, and
Yeah.
sitting on the couch and divining feelings from
Yeah.
the ether is very not structured, and it's not who we are, so I completely
Yeah.
get that.
It feels out of control.
Yeah,
That's the other, I think, the key piece. Like you're all of a sudden you're out of control, and I don't want to be out of control.
no.
But I was really lucky, blessed to have this therapist who was versed in some of this stuff that was where I didn't have to do, experience sort of the go back to the dark spaces fully. And she ended up referring me to someone outside who did something called brain spotting, which is a sort of a focused version of that same EMDR therapy. And I didn't go a ton. But again, I kind of went in smatterings. I'm one of those people, and I think like a lot of vets, the minute I felt good, I was like, okay, I'm good. I'm out. I'm good. Going back. And then what I'd found though is like once the stuff had started to surface, I was figuring out more and more. Actually understood when I was like, oh, this is like palpitations, stomach pain, and all this stuff that I wasn't feeling before. So I ended up going back, and the journey took me through. Yeah, I'd say I'm still on it, but through going and kind of processing through and understanding exactly how I face and deal with really hard, harrowing situations and things like that. The good news from it, and the reason I'm telling you the story is that I went into it. Oh, sorry. I didn't ever want to go to therapy or do any of those things because one, it was stigmatized, right? And two, I honestly, I felt like I could ride my bike hard enough. I could, work hard enough. I could just do enough stuff to like, I was happy. Yeah, I was happy. And on the outside, you'd say I was happy, and I thought I was happy too. But I was actually pretty emotionally dead. And as I look back, the military connections were pretty unique for me because they were forged out of like shared hardship. But part of the reason I couldn't really make connections outside of the military was because of the box. And so I didn't do well, like making real connections with people. I could be your boss, I could be your colleague, but I didn't really have deep friendships, for the most part. And so I didn't want to go into therapy though, because I thought, who will I be? What will my identity be as a physician, as a veteran, as a leader? as someone who wants to dive in and jump on the grenade, like, I don't want those things to go away. Like, that's who I am. Like, that's who I am. Like, I don't want to go to therapy and cry a bunch and then come out as like some person that wants to, go home at 3 and plant a garden. Like, so there's this huge fear for me. I lose myself, lose my identity, and so don't get help, because if I get help, the fixed version of me won't be able to go fight dragons. Right.
Yeah, and I think that's a very real fear for a lot of people because there's this thought process that therapy means replacing or
Yeah.
leaving this military identity that we all value
Yep.
behind.
Yep.
And as someone who's had to go through to therapy as well, um, I agree with what you're saying, and it's very much so like you don't leave it behind. You just get to figure out how to hold it in reverence without having it bog you down. Like the bad parts don't bog you down, but you can still have reverence for the things that make you who you are today.
Yeah. I'm
Um,
better. I'm a better
yeah,
version. And that's sort of the punchline.
yeah,
Is like now that I can actually feel most of my emotions, I'm much less likely to actually get to 10 out of 10, because I can actually feel when I'm at 3 or 4 or 5 or 6. I feel like, hey, what's going on? This person's really pissing me off in this conversation. Like, I'm, instead of just like, putting in the
yeah.
box and then I get to 10 and I'm out. Um, I'm more connected with my family. I'm a better version of those things. And I'm not less brave.
No,
I'm a little less reckless than I was before, a little bit less reckless. My mountain biking history recently. And so I'm not completely less reckless, but a little bit less reckless. Um, yeah. So I only say that as for the folks who feel like they're destined to feel the way they feel because they've always felt that way, or that they'll lose some part of themselves. That's just not accurate.
no. I think that that's such an amazing thing to bring up. And you talk about identity, and I mean, the crux of this podcast is really talking about who we are post-military. Like
Yeah.
that's the important thing because there are things in your military career that are valuable that make you an amazing family member, friend,
Yeah.
worker, citizen, and those will always be with you. But there are things that you have to kind of move on from or build past, and doing that does not mean you will lose who you were,
Yep.
but you are something different now, and that has to be addressed. And I think that your story is just so powerful because it's a great example of someone who has been able to work through that.
Yeah.